Hi, all. We'll start in about 30 seconds. I just want people to gather into the space. It's noon. All right, so hello everyone, and thanks for joining us today for our webinar, Words Matter. Is your structured terminology good enough? Before we get started, I'm going to go over for like a few things while you attend. The webinar is being recorded. It will be available to you after the webinar. Please note that anytime during this discussion, you'll have the opportunity to submit your questions to our panelists. To do so, type your question into the Q&A at the bottom of your control panel, and we'll set aside time at the end of the presentation for your questions. Today, we have two presenters speaking, June Bronnert, she's our Senior VP of Global Clinical Services, and Theresa Rihanek, she's our Mapping Informaticist. So on today's agenda, June and Theresa are going to be speaking about the importance of structured terminology at the point of care. They're going to define impactful documentation within EHR workflows. And then also you're going to get a chance to learn more about IMO's new and advanced terminology offerings. But before I pass it over to June, we're going to start with a quick poll question. Let me upload it. All right, so which of these healthcare areas are you most interested in? So is it behavioral health, dental, oncology, genomics and rare disease, home health, or long-term care? I'm going to give it a few seconds and then we'll close this out. All right, so it looks like behavioral health and oncology are kind of the top areas. All right, so without further ado, I'm going to pass it over on to June.
Thank you, Jordan, and welcome everyone. Let's start with the definition of terminology. The Oxford Dictionary defines terminology as the set of technical words or expressions used in a particular subject. As you can guess, medical terminology is the technical words or expression for medicine used to build the language of healthcare. As medicine advances, so does the need for the terminology to support the evolution. Since terminology is foundational, how does one know if it is solid for building clinical information? So let's take a closer look at the feature characteristics of good terminology. Starting at a high level, characteristic features can be defined as non-essential, which, as one can suspect, are considered features that are nice to have, but essential features are required. Here we can see 5 features important for good terminology. Precise is defined as exact accuracy of expression, and in the context of medicine, providing terminology to express an accurate description of the clinical condition is essential. Consistent is defined as done in the same way over time. Structured for our purposes is defined as arrangement and relationships between parts. This is especially key for electronic documentation and data exchange for interoperability. Closely related to precision is clinical granularity, which is about having the clinical details or grains available in a terminology in order to build the documentation. Future-proof is about the unlikelihood of terminology will become obsolete. This feature is important since the art and science of medicine evolves. If you think about the term dropsy, this was a common cause of death at one point, but now is an obsolete term. And all of these features describe essential terminology characteristics and are foundational to building healthcare documentation. Moving from paper to electronic has provided the industry opportunity to evaluate documentation and the terminology used to build it. Traditionally, medical documentation has been provider-centric. Facilities and individuals providing that care have been capturing and documenting for years. Common examples are the ancillary tests, the results, and problem list capture. Now we are seeing non-provider generated documentation take on a greater role in creating the overall patient stories. Examples of this are patient completed surveys. If you think about the social determinants of health questionnaires, as well as implanted or wearable device data that transmit information. So having sound terminology available to build the documentation, regardless if it is provider or non-provider generated, is vital, especially as the industry pressures continue to build. There are a variety of documentation pressures that require sound terminology, and this slide shows a sample of those pressures. Quality measure reporting, reporting the various data elements to demonstrate meeting or exceeding the measure is based upon documentation captured. And as the industry continues to move to value-based care, demonstrating quality plays an important role. Social determinants of health. It has been estimated that SDOH can influence up to 80% of health outcomes of an individual. The Office of Disease Prevention and Health Promotion, as well as Department of Health and Human Services, have established Healthy People 2030 initiative. The objective is to improve health and well-being by setting data-driven national objectives. Social determinants of health is one of those objective priority areas. And within that, there are 5 key areas or domains that have been established. Those domains are economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and then finally social and community context. And as we previously talked about with the patient survey data, the need to identify and treat SDOH needs relies upon documentation. Information blocking. While we could spend hours deep diving into the rules and regulations surrounding this topic, for our purposes today, it is key to remember that the pace and transparency of the documentation. So having that sound documentation facilitates that exchange of high quality of information that is being transmitted at paces very quickly today. And of course, I would be remiss if I did not mention documentation to support reimbursement. Reimbursement models and related workflows such as prior authorizations continue to evolve. And the documentation is the foundation driving efficient and appropriate reimbursement. Having terminology available to tell the patient's story is key. And so regardless of the pressure surrounding terminology, it's thoroughly woven into the creation of appropriate documentation. And so now let's look at some of the areas we will discuss today to highlight how IMO's enhanced terminology supports the documentation of the patient's story. Today, we will highlight terminology in the listed practice areas, as well as for the care settings of home health and long-term care. Finally, we will touch on a topic that demonstrates the future-proof feature, fair and equitable terminology. Theresa will review more later in the presentation, but before we deep dive into these areas above, we have our second polling question. Jordan, could you launch our poll?
Thanks so much, June. All right, so what challenges do you face when leveraging clinical terminology? Is it a lack of specificity, disparate data aggregation, identifying cases for clinical trials or research, managing for reimbursement for various reimbursement models, or gathering data for quality measurement reporting? So I'll give it a few seconds and then I will end it. So it looks like lack of specificity and gathering data for quality measurement reporting is kind of the high one.
Great, thank you, everyone. Yes, and specificity is key, and we'll talk through that in our various areas. But now let's start exploring behavioral health terminology. So in addition to general behavioral health terms seen here in our precise problem terminology, as reflected in the purple box on the screen, IMO also provides DSM-5 TR and DC 0 to 5 based terminology. The American Psychiatric Association, or the APA, publishes a manual to support the diagnosis and treatment of behavioral health disorders known as DSM-5 TR. The DC 0 to 3 organization further refines behavioral health terminology to support the diagnosis and treatment of children aged 0 to 5. Along with the terms are the recommended ICD-10-CM values. Here you can see examples of IMO's enhanced terminology that whereas we provide the appropriate terms in the green and the gray on the screen for DSM-5, as well as the DC 0 to 5 terminology. The recommended ICD-10 code maps and SNOMED maps are also part of the offering. And we'll look closer at this on the next slide. The IMO term is seen on the left-hand side of the screen. And if you think back earlier when we were discussing the terminology feature of structure, this slide shows this feature characteristic as IMO creates a relationship to industry standard code sets via the mappings. And we will see on the next slide a potential search using IMO's terminology and if one does not have IMO's terms. IMO recommends keyword searching, but for illustrative purposes to reflect the clinical granularity and specificity available within IMO, it is displayed this way. So searching by the word sensory within IMO's behavioral health terminology, at a minimum would return the search terms shown on the left. Performing the same search without IMO would not reflect this result, and potentially no terms would be shown, as without IMO, the descriptor for F88 reflects just the other specified neurodevelopment disorder, whereas with IMO, you have the ability to describe the patient's conditions with the hypersensitivity processing disorder or even a sensory over-responsivity disorder. And so the APA and DC 0 to 5 recommended descriptions associated with ICD-10-CM do not reflect the same level of granularity that I just talked about here on the left. So now let's look at another area that is rapidly evolving of genomics. The FDA defines precision medicine as stated here: disease prevention and treatment that takes into account differences in people's genes, environments, and lifestyles. And as precision medicine advances, so does the terminology needed to support it. And while IMO has been providing terminology in certain instances, these efforts have expanded, and we will look closely at those in the next few slides. Genetic testing continues to advance. The industry has seen genetic data play a role in disease management and prevention. Family members of patients can have testing to provide information in assessing their risk for developing a disease, such as breast cancer. And as far as regarding the disease management, genetic testing information may play a role in determining the treatment regimens available for individuals, such as in oncology and behavioral health conditions. Rare diseases present a unique challenge as they can be difficult to diagnose. Rare diseases are typically chronic and the disease state worsens over time. Genetics also plays a role in this and are generally the diagnosis for children for rare diseases. And their impact can range from cost of direct medical care as well as indirect medical care, such as home modifications, to other indirect impacts, such as the quality of life or potentially loss of income. It is vital terminology is available to support the diagnosing of these conditions throughout the patient's journey. And on the next slide, we'll look at one example. Noonan syndrome is a developmental disorder with characteristics of facial dysmorphia, short stature, and potential cardiac defects. Its causes may be from many different gene mutations. And so here's an example of the various levels of clinical granularity. Remember, this is one of our other sound characteristics that was mentioned earlier. And as one can see here, depending upon where a patient is in the diagnostic process, IMO has terminology available to capture the patient's condition that is known at the time. And so if you think about this in relation to standard code sets such as ICD, many times the Q87 codes, which are typically titled with other congenital malformations, are the most appropriate codes available. And while SNOMED may provide different levels of granularity, the codes typically are not as granular and IMO, and IMO still provides a more granular level. of these clinical details, as you can see here on the slide. And so while there are rare disease and genetic connections, there are other use cases for genetic testing information. And on the next slide, we will touch on IMO's terminology for those cases. IMO provides structured genomic terminology that will help enable interoperability for pharmacogenomics within EHR systems. So again, the terminology contains industry standard code maps, which can be used to support a variety of workflows, such as connecting lab results to genotypes. And IMO will continue to connect additional content as the industry continues to advance. As you can see here on the slide, there are a variety of code sets ranging from link answers to ICD-10-CM, as well as SNOMED, but note the "and more" circle. And so that is that we can seamlessly add additional sets as the industry needs evolve, such as HPO or OMIN or Mondo can be associated to IMO's terminology. So now turning our attention to dentistry. Here's an example of IMO's dental terminology with various industry standard code sets. And you will see IMO has terminology to support commonly seen conditions that are shown here with the tooth fracture, and less common terms, as we will see on the next slide. Allows for providers to capture the clinically appropriate diagnosis, like I said, even for the less common conditions. And just as our customers are used to with IMO's other terminology, the dental terms are mapped to the appropriate codes to be used in the various downstream workflows. And now I would like to turn the presentation over to Theresa to review additional areas.
Thanks, June. I'm going to start off talking about IMO terminology and oncology workflows and how it can help enhance your reporting capability and help with some data analytics later on. So like June has showed in previous slides, we have our clinician-friendly terminology. So in this example, we have inflammatory carcinoma of the left breast. And like with other terms, we provide the SNOMED, the ICD-10-CM, the ICD-9, but with our oncology-related terms, we provide ICD-03. And that is a very comprehensive code. And with the ICD-10-CM code, we also are providing a flag with those ICD-10-CM codes that identifies the case as reportable per the SEER case finding list for reportable tumors. So maybe that could be leveraged in directing cases directly to the cancer registry. So when we look at the ICD-0 code, it has several features, and it's quite a long code. So the inflammatory carcinoma of the left breast is represented in ICD-0 with the topography code, which is the first portion, C50.9, which represents the location, which is the breast. And then the middle portion is the morphology or histology, and this identifies that inflammatory carcinoma. The /3 identifies the behavior of the tumor, which in this case is malignant. And the last character represents the histological grading. And so in this case, it's 9 because it wasn't stated in the term. There is a little bit different classification for leukemias and lymphomas, which is really related to that last character. But for here, this term, adult T-cell leukemia, you can see the topography is still defined as the bone marrow. We have the morphology histology code for adult T-cell leukemia and lymphoma. And then that last character identifies the immunophenotype designation, which in this case is a 5 to represent a T-cell. So when we look deeper into oncology-related workflows, once your provider documents that oncology-related term and it's sent into your database with IMO, you have the additional coding mapping information for ICD-0, ICD-10-CM, and SNOMED. And so you can do a variety of things with that ICD-0 code, which is what we want to focus on today. So if your oncologist is interested in finding her patients with inflammatory carcinoma of the breast, it can be quite a challenge to get that out of a system using ICD-10-CM codes, because those ICD-10-CM codes are not that granular. You would just get primary malignant neoplasm of breast, the quadrant, and the laterality, and have to dig through to find which cases were actually inflammatory carcinoma. So being able to leverage the ICD-03 topography portion and morphological portions of the ICD-0 code will help that oncologist find the breast cancer patients that are specific to inflammatory carcinoma. That helps to reduce the amount of time you need to find the cases rather than sorting through all those encounters to find that have patients with breast cancer to figure out which ones are the specific morphology that you need. Additionally, you can use the ICD-0 code to leverage for research cohort selection. There are also research studies that require the use of that ICD-03 code to be reported back rather than using another terminology like SNOMED or classification like ICD-10. So IMO makes it easy for users to identify those cases and assign the reportable codes without requiring that additional legwork on the back end. And that information is available when the researcher needs to leverage it. We also wanted to mention that it's helpful in internal service line reporting. So if your oncology service line wants to know how many patients they've treated with adenocarcinoma of the lung or inflammatory breast cancer, to do, look at costing or different marketing opportunities, that ICD-0 code can be very helpful. And finally, IMO has the capability to standardize clinical data from diverse systems into consistent, structured, and clinically validated terminology with that specificity that you need. So if you have data in multiple databases or different systems, IMO can help you turn that into a structured data set that you can do that data analytics on that you're interested in. So we're going to look now at home health and long-term care. Our precise problem terminology is a valuable asset in both of these settings. We allow clinicians to say what they mean using their own words rather than a prescriptive code description. So your clinicians can document their clinical intent while at the same time capturing the appropriate ICD-10-CM and SNOMED codes behind the scenes. IMO continually curates and updates our terms to remain current with changes in medicine, as well as maintaining the associated mappings to save your organization time. And that accurate documentation in your clinician's own words assures accuracy and supports optimized billing and reimbursement. And the example here on this slide identifies that the mapping data associated with this term for pressure ulcer of a sacral region, stage 4, gives you the ICD-10 code, the SNOMED code, as well as the patient-driven groupings model specific to that clinical group and the comorbidity flag. And here that comorbidity flag is 1. So when we, so our terms are flagged that are associated with the PDGM clinical group through our ICD-10-CM mapping. IMO terms that are in clinical groups also receive that comorbidity flag, like I showed you, with a 1, and that helps you simplify the identification of where secondary diagnosis can translate to reimbursement adjustment categories. And as you saw, the 1 meant that term for that patient, that diagnosis was in a comorbidity adjustment group, and if it's a 0, it means it does not participate. So in the home healthcare space, IMO can assist your team to capture complete diagnosis and treatment detail with accurate PDGM categories. So that improved documentation betters your overall data quality and can assist you in securing optimized reimbursement. So using IMO Core will allow clinicians to focus on care delivery, and that process also allows for data quality, starting with documentation at the point of care. And this can assist you with accurate billing and coding. It also supports appropriate care using that specific terminology. And as we provide the mappings behind the scenes to ICD-10-CM and SNOMED, that code capture is done automatically when you select your IMO term. Because the documentation is of high quality, this can assist your quality teams and your coding staff later on when they're coding or auditing for OASIS assessments. And overall, it improves your productivity and reduces the resources needed to handle a lot of back-end functions of documentation. In the long-term care arena, IMO provides the same quality-specific clinical terminology to allow for efficient and appropriate documentation. So in this example, the clinician can easily select components to describe a fracture and its state of healing to document the very specific terminology. As you see, we also provide down here at the bottom the 10cm code and the SNOMED code along with it. And one of the enhanced features of this product is that we also flag the ICD-10-CM code associated with our terms that are components of the patient-driven payment model. So IMO makes it easy for you to identify those patients that may be included in this payment model because the clinical component or the speech language pathology, non-therapy ancillary component, et cetera, are identified. Now let's look at fair and equitable terminology. So as you all are probably aware, expectations for diversity and inclusion have grown significantly over the past few years. We want to be careful of the words that we are using. So IMO has embraced this challenge to provide more fair and equitable clinical terminology across healthcare. We want to support our clients' diversity, equity, and inclusion initiatives. And in healthcare, as you know, the historical use of some terminology has been under increased scrutiny. So IMO has been evaluating and reviewing our terminology to assure it's clinically accurate, but without stigmatization. So we're committed to conducting a thorough and thoughtful review of problem terms to examine clinical intent, as well as any possible unintended impact. So we look at terms for outdated or offensive language, descriptions that are or may be interpreted as disparaging towards a particular people group or individual, and potentially judgmental rather than descriptive terms. So as we examine those terms, we've been researching and developing appropriate clinical terminology, and as well as removing potentially offensive terms from visibility for both patients and clinicians. Oops. I got a tricky mouse. So we've been working closely with industry experts to ensure we understand the impact of terms as they exist today and the potential consequences of any changes that we consider so we don't indirectly cause any other issues. We're open to collaborating with our clients and our partners on other approaches that can assist in addressing specific needs or preferences related to fair and equitable terminology. There we go. So as we wrap up, we want to leave you with these thoughts. IMO is continually exploring and expanding our terminology and the code sets and terminologies that we support. We provide our clients with specificity for documentation that's needed at the point of care and far beyond that encounter to support a variety of downstream functions and future data analytics that might be needed. And maintenance, we are always curating our content to stay current with medicine. We are providing that update to the code sets as they evolve and as new codes are implemented. And we update the reimbursement information that we provide associated with our code sets once they're provided from the authoritative agency. So we want you to know that IMO is here to help you document the patient's story and provide you with that underlying metadata to make healthcare better in your organization and beyond. And now I'm going to turn it over to Jordan for some questions.
Awesome. Thank you, Theresa and June. All right, so we'll be kicking off our live Q&A. If you had any questions from today's webinar, questions you had coming into the webinar, enter them now and we will begin answering. Just note that there might be some brief silence for a team to review and answer. All right, Theresa, this one came in earlier. How often is your content updated?
So we are continually updating our content and releases, and we release our content several times a year, depending upon the product. We ensure you get those regulatory updates with code set updates such as ICD-10-CM, CPT, SNOMED, and so forth on time. And our release information is available through our support portal, and we can direct you to that if you need help finding it.
Great. Okay, another one came in. When will these terminologies be made available?
So this is June, and the terminology we have available. If you would like to reach out to, we have various sources, I believe on the next slide for sales support and questions, and you can reach out. We will be giving you that information to contact for our additional information around any particular terminology, as well as questions for those areas.
Right, another one came in regarding the problem list. He said, my clinicians are heavy problem list users. Will the terminology show up on the problem list?
Yeah, so the terminology that are available within the system are available to be for the search and selection and to be made available on the problem list according to what the content and then terminology that you're licensed to, to at your organization, if it is appropriate from that perspective of being considered a problem by your organization. Since we have a wide variety of terminology, there are some that where that it is not necessarily related for that search and selection for considered a problem. But from what we have talked about today, yes, it is available for the search and selection and to be used not only on the problem list, but other downstream impacts and workflows as your organization determines.
Great answer. All right, it looks like that's all the questions for today. So we're going to go ahead and close out. Hope you found the information in today's webinar useful. June and Theresa, awesome job. If you want to learn anything about IMO or mention in today's webinar, please email sales@imohealth.com. I appreciate you taking the time and attending, and I hope you have a great rest of your day. Thank you so much.